Oh no, is this done? Is this a fracture? Is this tooth hopeless? We're confronted with these situations all the time these days. And the reality is we have to look at all possibilities. One is fracture for sure. Secondly, though, could there possibly be a lateral portal of exit that could be causing this type of bone loss? So you can see on 2 dimensions, not as clear, much more subtle than 3D, but yet you can see something's happening here. And you want to be thinking in 3D when looking at your 2D images. Now, when we go into 3D, we can see very clearly, very abrupt bone loss right here. And it's interesting because it doesn't necessarily represent the full vertical length of a fracture. Now, if that bone loss, which you see has eroded the buccal plate, if that extends up through the cortical plate, up through the furcation, you can see this massive bone loss, especially over time. Now, if this tooth was testing vital, which it was not, that would be a much better indicator of fracture. But this tooth was necrotic, non-vital. And what we're starting to see here is the potential that there is a lateral portal of exit here, and that's actually where the necrotic material is escaping and causing this more severe bone loss pattern. So ultimately, you can see here on the distal, also a big lesion. We're nowhere near the IAN at this point, but when you're discussing and thinking about your prognosis, remember, lateral portals of exit. So look at this. We had the lateral puff of bioceramic sealer indicating as a storyteller the anatomy, and recognizing that at that location over time, you could see this massive amount of bone loss. So is it fractured? It's possible. Will it heal? We won't know. We'll see the patient back for follow-up, and I'll keep you posted.